Hi everyone. Are you struggling with weight loss or is someone you know struggling with weight loss and even after taking multiple treatments there are no results? You know why? Because it's not being done scientifically. I am Dr. Apurva Samant, plastic surgeon from Harmony Clinic, Villeparle East, and we at our clinic have devised a protocol. So what is it exactly? We are a group of doctors, myself a plastic surgeon, I have a nutritionist with me, and another a radiologist who looks after the scans. Whenever we meet a patient, we first assess the patient's lifestyle, the food habits, take on into consideration his BMI and his fat distribution. We assess it sonographically. We look after the fat distribution around his internal organs, in the subcutaneous tissue, and overall in the abdomen and other areas as per the patient's needs. We collaborate that information along with the patient's lifestyle and we tell him what changes he can do from nutritional advice to psychological advice along with exercise advice. We take everything into consideration and give the patient a 2 or 3 months plan. Then we keep following up with the patient to see what changes that has brought into his life. Changes may not necessarily be on the weighing scale. It may be a change in the mood, it may be a change in the feeling of being healthy, it may be a change in the hair, it may be a change in the quality of sleep. And every positive change is a good game for us. If then the patient feels that even after the weight loss, there are certain areas that need to be managed a little more aggressively, and that maybe now after weight loss, the skin has become loose, then we categorize such patients into needing surgical treatment. What are these surgical options? So, if you have lost a lot of weight, suppose you started with us and now we're looking after something like more than 10 kgs of weight loss. And not only just weight loss per se in a very short span of time, maybe a gradual weight loss, but still that may lead to some hanging skin, some loose skin, areas that do not look good per se. So these areas need to be treated surgically. We do skin resections, skin tightenings, and give you a contour that is now aesthetically pleasing. So what if even after weight loss, there are certain rigid areas, like there is no skin loss or loose skin, but you've necessarily not reduced inches. In certain areas, like the tummy or maybe the arm or maybe the thighs, sometimes fat can be stubborn. In these areas, we do liposuction. So, what is liposuction? It is a method of surgically removing the fat and tightening the skin along with it so that you get the contour that you want. And now, a win win situation wherein you had to completely like avoid surgery. You started thinking that maybe weight loss means I have to go under the knife, I have to do liposuction. But our scientifically programmed protocol made you lose weight, made you become happy, and made you understand your metabolic changes in a better way. And we got you treated nutritionally with exercise and with certain, lifestyle changes. So that is a win-win for you and for us, right? So come with us and we will guide you through the same, taking into consideration your lifestyle, your weight loss journey, your psychology, and guide you accordingly.